Hello, hi, this is Dr. Deepthi Nandan Reddy. I am a shoulder and upper limb surgeon, so I mainly deal with injuries of the shoulder, elbow and hand surgery. That is my expertise. I work at Yashoda Hospital, Hitec City. Today we're going to talk about wrist injuries because you have a fall, then you have some pain in the wrist or the hand. You go to a doctor, you get x-rays done, they tell you it's all normal, no fractures, but you continue to have problem with your wrist and hands. In these situations, we have to have a detailed assessment of the wrist and hand, fingers especially, because the wrist is very complex. It has 8 bones, and these bones are linked together by these structures called the ligaments. And these ligaments are very important to make sure that these bones are working together in a sync. So when we move our wrist up and down, these bones have to move as a cycle chain, like a link. If these links are disrupted, then you have problem with your wrist, and you continue to have residual pain, disability. Whenever you try to lift anything very heavy, you have pain. And these are situations where specialist in wrist surgery and hand surgery comes into play, because we assess each ligament and bones individually and find out if there is any damage to these ligaments. One other important thing which we notice in patients who have had a fall and had no fractures but continue to have pain is they get pain on the ulnar side. That means the inner side of their wrist, because there is one important ligament linking this bone, the radius, and the ulna, that is called the triangular fibrocartilage. If that is damaged, you continue to have pain. This is a very common injury seen in sportsmen who have a fall on their outstretched hand, and these ligament injuries are only diagnosed if you are thorough in your examination clinically. Once the examination is done, depending on what the condition might be, we ask for a MRI of the wrist, which will give us the exact nature of the soft tissue damage. If the ligament injury is not healing well, we have various surgeries which are required to stabilize these bones before we make it function normally. Stabilizing these bones are very important because they work as a link, and if the link is broken, you get more load on one side of the wrist than compared to the other, and this causes arthritis in the long term. And when this arthritis is set, we cannot reverse it, so we need to do things like fusing these bones together, which are more complicated procedures. So the gist is that prevention is better than cure, and to identify these injuries early on and give the right and optimal type of treatment for these injuries.